for a long time.
تاني هنبدأ
The candidates are dropping. So regarding hereditary hemorrhagic telangiectasia, the scenario of the patient, this patient is complaining of fatigue, or maybe he will give you some data about the investigation with low hemoglobin level. And also another scenario can be with epistaxis, recurrent epistaxis. This is a scenario of hereditary hemorrhagic telangiectasia, recurrent epistaxis, fatigue, low hemoglobin level. Okay, how to approach a case of hereditary hemorrhagic telangiectasia in the exam? So, of course, also hemorrhagic telangiectasia the scenario can come with skin rash and epistaxis, skin rash with fatigue, skin rash with low hemoglobin level. So if it is coming with a skin rash, you will have to ask about onset, course, duration, progression of the rash, any improving factor and any worsening factor. Okay, so then we'll start from above down below. What systems are involved in hemorrhagic telangiectasia? We'll start from the head of the patient. So this patient can come with neurological manifestation. Why? Because there may be aneurysmal lesion or AV malformation in the brain. So we have to ask about all neurological manifestation for the patient. So any headache, any loss of consciousness, any shaking movements, any weakness, any sensation disturbance, any gait disturbance, this is for CNS. Then هننزل شوية down. Nose, any history of nasal bleeding or other body orifice bleeding, and if there is any bleeding, how frequent is it, and what about the amount? Then هننزل شوية down. Cardiovascular system. You know, this patient may have anemic heart failure because of severe anemia. So you have to ask about any chest pain, racing of heartbeats, shortness of breath, leg swelling. Then lung. You know, this patient may have lung affection. How the lung is affected in hereditary hemorrhagic telangiectasia? It can be by the presence of AV malformation in the lung. So you have to ask about any cough, coughing up blood, and noisy chest. Then down, GIT. GIT, any history of tummy pain, feeling or getting sick, vomiting up blood, bloody back passage, yellow discoloration of the eyeballs. How hemorrhagic telangiectasia is affecting the GIT systems? It can cause AV malformation in the gastrointestinal tract. It can cause, it can cause also, cirrhosis, liver cirrhosis, and hepatomegaly. It can cause also telangiectasia, and the AV malformation can occur in the GIT. The liver also can be involved in the form of hepatomegaly, cirrhosis, portal hypertension, and mesenteric angina. So these are all the systems involved in hemorrhagic telangiectasia. Of course, don't forget about the inheritance, any family history of similar condition or recurrent nasal bleeding or sudden death even. This is very important because hemorrhagic telangiectasia is autosomal dominant, so must be there is family history of similar condition of recurrent bleeding or recurrent nasal bleeding or sudden death. Why sudden death? Because of aneurysmal rupture or AV malformation problem in the brain. So again, For hemorrhagic telangiectasia, if the problem skin rash, you have to ask about onset, course, duration, progression, improving factor, worsening factor. Then to ask about symptoms related to the skin hemorrhagic telangiectasia. We'll start from above, not to forget any system. So the brain of the patient can be affected in the form of aneurysm and brain aneurysm or EV malformation or even paradoxical embolism. Why paradoxical embolism? Because they have AV malformation in the lungs, so that the emboli can be transmitted from the portal system to the systemic circulation and cause paradoxical embolism. So you have to ask about all neurological manifestation, any headache, loss of consciousness, shaking movements, motor power affection, any sensation disturbance, abnormal gait. Then the nose, this such as having recurrent nasal bleeding. So any nasal bleeding or other body orifice bleeding. Then down شوية, cardiovascular system, any chest pain, racing of heartbeats, short to suppress, or leg swelling. عشان why? Because this patient may develop anemic heart failure. Then the lungs. The lungs can be involved in hemorrhagic telangiectasia in the form of AV malformation and telangiectasia of the blood, the lung tissue, so that may develop also hemoptysis. So any history of cough, short to suppress, coughing up blood, noisy chest. GIT, hemorrhagic telangiectasia there may be telangiectasia of the GIT, or maybe hepatomegaly, or liver cirrhosis, or portal hypertension. So you have to ask about GIT symptoms. Any tummy pain, feeling sick or getting sick, vomiting up blood, bloody back passage, yellow discoloration of your eyeballs. Any family history of similar condition or recurrent nasal bleeding or sudden death. Then, as in all cases, social history, what did you as a job? How much the symptoms impact your job and usual daily activities? I'm sorry for that. We refer you to a social worker to solve this problem for you. With whom you are living with? Do you smoke at all? Do you drink alcohol? Do you have then medical history? Do you have any medical illness of note like diabetes, hypertension, heart disease? Do you have family history of similar condition? Drug list. Can I see your drug list, please? Then to ask about the concern of the patient. Examination. Of course, examination, you will examine the complaint first. This patient is coming with skin rash, so you have to check for skin rash. He will have some telangiectasia around his nose and oral cavity. You have to examine by torch. Then you have to examine the chest of the patient. Why to auscultate the chest? Auscultate for Berwi. AV malformation in the chest can have Berwi. Examine the cardiovascular system for signs of anemic heart failure. Raised GVP. Of course, you will start with the pulse, because such this patient may have tachycardia reactive to anemia. GVP, bilateral basal lung auscultation, and lower limb for breathing edema. I'd like to examine this patient abdomen also. Of course, I don't think that the examiner will let you to examine the abdomen. Why to examine the abdomen? For signs of portal hypertension, palpate for hepatomegaly, and auscultate for Berwi of AV malformation in the abdomen. Again, the examination is examine the rash. Examine the rash. Examine the rash for telangiectasia. Examine the chest for auscultation of Berwi of AV malformation. examine the cardiovascular system for signs of heart failure, and take permission from the examiner to examine the abdomen for signs of portal hypertension, palpate for hepatomegaly, auscultate for degree of AV malformation. This is if the patient, if the examiner give you the permission to examine the abdomen. Dr. Ahmed, just to mute the mic, please. There is echo coming.
معلش هو المايك.
Okay, so how to answer the concerns of the patient with hemorrhagic telangiectasia? What could be the cause of my fatigue, doctor? Most probably you have a condition called the hereditary hemorrhagic telangiectasia. It is a multi-system disease affecting many systems in your body, involving your skin and also superficial small blood conduits, which can cause easy bleeding from the nose. It may be involve your lungs, your gut, your liver, and your nervous system, your brain. It is a disease running in the families actually. So what you are going to do for you is to do for you further blood test, including CBC, complete blood picture to know how much your anemia is, and some imaging to confirm our diagnosis. Then if we confirm our diagnosis, we refer you to a multidisciplinary team to give you the proper plan of management, including social worker, internist, chest physician, gut physician, and maybe nervous system doctor. Okay, what will be the treatment, doctor? The treatment for you will be maybe blood transfusion or iron injection through a needle according to your hemoglobin level. Then you can continue on oral tablets of iron with regular follow-up with a multidisciplinary team. Would my son have the disease, doctor? دكتور أحمد دكتور شادي جاوب لنا. I have 2 kids, doctor. Can my kids have the disease? Dr. Shadi?
Well, this is yes. So this is autosomal dominant disease. It runs in families. So his children will be most likely affected than others.
Okay, how much, doctor, the percent or the chance my children to have the disease?
I can't remember الصراحة معلش.
دكتور أحمد أبو كيفو. Dr. Ahmed Abu Kifu, you know how much the chance of the children to have the disease in hereditary hemorrhagic telangiectasia? Dr. Ihab Saad. Okay, hereditary hemorrhagic telangiectasia is autosomal dominant condition, so
autosomal dominant it would be 50%.
50%. So that your children, as we know, Dr. Shadi, we have to avoid jargon with the patient. Don't tell him that it is autosomal dominant condition. You will tell him that it is a hereditary disease. It means that it runs in families, and the chance of your children to have the disease is 50%. I'm sorry for that. Okay, so
okay, thanks.
What you are going to do for this patient, I'll do investigation in the form of basic investigation, CBC, electrolytes, kidney function, liver function, and also genetic screening. and I can do interpretation of MRI if there is neurological symptoms of the patient, because this patient may have aneurysm. If there is no neurological symptoms of the patient, you are going to do CT brain or MRI for the patient?
No.
Of course, we have to do CT brain and MRI as a prophylaxis to know if there is any aneurysms for the patient, and we can do elective surgery if there is large aneurysm for the patient, elective ligation or aneurysmal ligation or removal, maybe to avoid any brain hemorrhage in the future. So that we have to do CT brain for the patient.
MRA, right?
Yes, Dr. Amjad?
Like in that case, if they ask CT MRI or MRA if they ask for screening.
MRV.
MRA and MRV, right? Because CT and
MRV is more
MRI
specific for the aneurysms and AV malformations.
Yes, exactly.
Yeah,
Okay.
I agree with you.
No.
Okay, what is the treatment for this patient? As we know, in each case, the treatment would be in the form of non-pharmacological treatment, patient education, counseling, occupational therapy, and psychosocial support. Then specific treatment in the form of how to treat the patient if there is recurrent epistaxis, for example. So this patient may need laser ablation or cautery of his telangiectasia of the nose. Okay, for skin telangiectasia, this patient need also maybe laser ablation. For anemia, this patient needs iron replacement. For pulmonary AV malformation, this patient may need embolization or surgical ligation. For GIT telangiectasia, this patient may need blood transfusion or photocoagulation therapy. So you will treat this patient according to the system involved. يبقى anemia, treatment of anemia by iron supplementation or blood transfusion. Epistaxis by cautery or laser ablation. Skin telangiectasia by laser ablation. Pulmonary AV malformation may be by embolization or ligation. GIT telangiectasia may be with photocoagulation therapy or blood transfusion if there is severe blood loss. That's all for hemorrhagic telangiectasia. Anyone want to ask about this case? Have any question regarding this case? There is criteria called the Chauvelin criteria for hemorrhagic telangiectasia. It is 4 elements. If any 3 of these criteria are present, this is a diagnosis of hemorrhagic telangiectasia. If there is recurrent epistaxis, if there is telangiectasia at the site other than nasal mucosa, if there is evidence of autosomal dominance, if there is visceral involvement, any 3 of these, so it means diagnosis of hemorrhagic telangiectasia. This is called Chauvelin criteria of hemorrhagic telangiectasia. Recurrent epistaxis, telangiectasia in any other site rather than the nose, evidence of autosomal dominance, and the visceral involvement. To be clear, hereditary hemorrhagic telangiectasia is not coming frequently in the examining. It's a rare case, actually, but we have to finish all the dermatology cases. Any question regarding Osler-Weber-Lenzo? We know hereditary hemorrhagic telangiectasia is called also Osler-Weber-Lenzo syndrome. Dr. Ihab? Any question?